Let's talk about some good news. If you're looking for a career path that is stable, flexible, and growing even as the economy is shifting, you're in the right place. Today, we're diving into a big question that I get all the time, and that is medical coding recession proof? And maybe the better question is now actually a good time to start? So, whether you're looking for a career change, you're trying to build something sustainable for the future, or you just want a job that maybe is going to work a little bit better around your life, I'm going to show you why medical coding might be one of the smartest decisions that you could make in 2025. By the way, if you're new there, hey, I'm Victoria. I'm a medical coder, auditor, educator, and content creator. And on my channel, I provide tips, tricks, and tutorials to help you be successful in a medical coding career. Now, with the cost of living on the rise, people are craving a lot more work life balance, and people are looking for careers that are not just stable, but they're also a little bit meaningful and much more manageable. When people are reviewing like what careers to consider, one of the big things that sticks out about medical coding is it checks a lot of boxes. It's part of the healthcare industry, which healthcare continues to grow year after year. People want to work remotely, and this is an industry where there is a high prevalence and historically has been, even pre-pandemic, a high prevalence of people working remotely. You don't need to get a full college degree, and you can get trained and certified typically in under a year. And that's a big deal in today's world, especially when people are trying to make smart, very cost effective choices about their future because they don't want to wind up swimming in student loan debt and regretting their choices. But let's define what we mean by recession resistant or maybe recession resilient. It doesn't mean that a career is totally immune to change. I don't think there's any single career out there that might be totally immune to change, including medical billing and coding. But it does mean that there is a consistent demand for the skill set and that you're working in a more essential industry and it doesn't rely on things like trends or luxury spending. And healthcare, just in general, is a really good bet. And medical coding, it's kind of in this heart of it, like nothing gets billed, paid, or tracked properly, even for our data and our analytics, without a proper coder behind the scenes. And I personally actually made it through the Great Recession in the 2000s while I was in the medical coding field. And there were others in my area that maybe were making an early departure deal or they were even just getting straight up laid off. I was fairly safe due to positioning myself very well and also having medical coding certification. And here's why medical coding really isn't going away anytime soon. First, we have this aging population. Aging population means a lot more doctor visits, a lot more procedures, a lot more care. Not to mention that, I don't know, maybe this is just me, but I feel like healthcare in the United States is not holistic. So there's just a lot of different activity going on with our populations, especially in certain geographical areas. Not to mention, the healthcare system is very complex all around for people working in healthcare and for people that are consuming healthcare because it gets more regulated every year and there tends to be a lot of changes. There's also this big rise of telehealth. Coding is needed across more care settings than ever because we're deciding that we need to develop different opportunities and different ways to deliver healthcare. And of course, insurance billing, that is still a big piece of the puzzle that, you can just work in medical billing. And medical coders, even more and more these days, have to know more about billing than previously. We used to kind of be in the solos. Here's the billers, here's the coders, but the coders need to know a good portion of the billing concepts because more coders are getting things back to them and going, hey, we need you to troubleshoot some of these insurance denials. And healthcare does not stop when the economy shifts. People will still get sick. They still go to the doctor. I mean, some people might put it off longer, which that's a whole other discussion we could be having. But providers still need to get paid for those services, which means we still need billers and coders. They are essential. And in case you are new, let me backtrack just a little bit and talk about What is medical billing and coding? So, medical coding is that process of translating medical records into standardized codes. Some of the common ones we use for like provider based services are ICD 10 CM, that's for our diagnoses. CPT is for procedures and services. And then we have HCPCS codes or HCPCS, and that's for supplies, injections, medical equipment, and then some services like Medicare just wants a special code for, even though we have another code that might other services. But yeah, we use those services for billing insurance. That's the primary one that people think of, but also things like tracking care quality, keeping patients from being overcharged, and also seeing like where there's outbreaks of different diseases or progression of diseases or what services people are having that's maybe controlling their conditions better. So when I say coders are essential, I really do mean it. And here's the part a lot of people want to know about: how can you get started? You don't need a degree, you don't need years of school. You don't need to spend five to $7,000 on a name brand program just to get your foot in the door. What people are really looking for is the certification. And I recommend Preppy if you are looking to start out because it is fully online, it is self-paced so you can study around your schedule. It helps prepare you for the CPC certification, which is certified professional coder. That is our gold standard in the industry for profi coding. It includes 80 contact hours, which helps remove the apprenticeship status or the CPCA status. And you get externship opportunities, which is very, very rare to find anywhere. And that will help you build experience before you start applying to jobs or even while you're applying to jobs. And yes, they do offer payment plans. It is a very affordable program and you can have payment plans. But if you pay in full, they will even give you a free laptop with your program if you qualify. And I've worked with hundreds of people who have gone through Preppy and they have launched successful careers without going into crazy student loan debt or without quitting their jobs so that they can go back to school. If you want to find out more about this career and more about Preppy, you can sign up for my free career masterclass at medicalcodingmasterclass.com to find out more. And I want to thank Preppy for sponsoring this video. Now, in 2025, people want options that feel a little bit more safe, they feel like a smart choice, and they feel strategic. And that's what medical coding can offer you. It offers that remote work opportunity if you're someone who's interested in that. We do still have on site opportunities out there, especially as you grow. If you're someone who's like, maybe I want to start out remotely, but I want to grow into that, maybe once my kids are in school, the more you climb up the career ladder, there are opportunities out there. And if you're someone who's like wanting to work a little bit more at the elbows, go out and do auditing, like you can make a good salary doing that. There's also certification. So there are costs of certifications, but there's a lot of additional certifications you can get that can help build your career portfolio. There is real world demand and there is some growth potential. And most importantly, it is a career that you can build at your own pace and on your own terms. So if you're someone who's like, I just want the baseline coding certification, I'm okay with not putting myself out there and getting a million certifications and doing, data improvement and all that stuff. Like you can do that. You can be like, I just want to be a baseline medical coder and work my 40 hours a week and clock out and go work on my hobbies. Like, cool. But if you are someone who is more ambitious, there are a ton of opportunities out there for you as well. So, is medical coding recession proof? It is a fairly stable, flexible, and in demand career, and it is one that you can get without a degree. Now, that doesn't mean like any other career, there aren't times where you might come off of one job or have contract work, and there might be a lapse between you getting the next job or the next contract. But with those skills, it's a lot easier to find the next opportunity than it would be if you were just continuing to do, for example, unskilled labor. If you're ready to take the first step, again, I highly recommend checking out Preppy. I will link it in the description so you can find out more and see if it is the right fit for you. And if this video helped you feel a little bit more confident about your next move, don't forget to like, share, and subscribe, and let me know in the comments where you're at in your journey. Thank you for watching. I will see you guys in the next video. And until then, just keep on coding on.